Hello, I'm Harry Hobson, President and CEO of Plymouth Harbor.
And I'm Karen Novak, the Administrator for Strategic Health here at Plymouth Harbor as well.
Karen, today's update on January 18, 2021, I'd like to give a campus update like we normally do, and then we'll go into a little more detail today regarding the vaccination process, which, as you know, we will commence phase 2 this Wednesday, which is January 20th. We'll spend some time talking about that and then teeing up the following one after that, which is going to be a week from today, which is January 25th. You know, Karen, as I did this morning at one of our team meetings, I wanted to take a moment today, January 18th, 2021. This is the day that we set aside and remember Dr. Martin Luther King. When I think of Dr. King, I think of a man of substance, vision, humility, and superior leadership skills. He'll never be forgotten for his vision or the words that are often associated with the civil rights movement. We shall overcome. As we said earlier today, those words speak volumes today as we're in this fight against the coronavirus. So attempting to mirror Dr. King's commitment to civil rights, I know most of us believe that we shall overcome the challenge that lays at our feet today. You brought that quote, that song up this morning in our meeting, and I'm so glad you did, because it's a natural, isn't it?
It is. It is such an obstacle that we are looking at, but you know what? We've got this. I am so excited for Wednesday to get that vaccine, to get that immunity. Boy, we are overcoming COVID. Absolutely.
And we'll talk a little bit toward the end of this video regarding what we're doing to further educate all of our team members. And everything that we'll be talking about today will be in this splash, which is being released today. Most people will have those or this copy when this airs later today. So Karen, let's go ahead and begin with a campus update if we could.
Currently, we have 4 residents that are positive. They are all in our COVID unit. 2 of them are actually going to get discharged to their independent unit here in the tower, and we're going to have some private duty overseeing their care. They are doing phenomenal, and we're very happy to have them back at home. We also have 2 more residents that are positive that are in the COVID unit over in the Smith Care Center. We do have 2 residents that are out on observation, both of which are doing quite well and being monitored by the nursing staff in home care. We have 2 staff members, one's a nurse and one's in housekeeping, that are positive, and they are coming towards the end of their observation isolation period. And believe it or not, Harry, we only have 1 of our team members that is in observation. So I'm proud to say that the majority of our staff, our team members, are back on board, and we are so happy that they're back.
When I looked at that report early this morning, I was so surprised and relieved that so many of them are now back.
Yep.
So, excellent. Well, let's talk about the vaccination process. Once again, as I did last week, I want to reassure everyone, regardless of what you're hearing on cable news or reading in the media, the vaccines will take place here at Plymouth Harbor, both this Wednesday, January 20th, and next Monday, January 25th. And that's been confirmed by all of the key parties involved. Now, as I said, as we move into phase 2 of the vaccination process, it will include not only the booster vaccine for those who originally received the vaccine, but it will also include the initial vaccine for those who may now decide that I want to move ahead with that vaccine. Now, phase 2 will occur on 2 dates. These dates include January 20th. once again, for those who received their initial vaccine on December 30th. Karen, I know you received yours that day as I did. So I'll be looking forward to this Wednesday to receive that booster. Then next Monday, for those who received their initial vaccine on January 4th, they will now receive their booster on the 25th. Now, it should also be noted that on January 10th or 20th, we will also be offering the vaccine to those who have reconsidered and now wishing to receive the vaccine. And I hope more and more of you do, particularly on the team member side. Now, Wednesday morning, and I'll focus on that for now, I'll be making a general announcement over the public address system at 9 a.m. This announcement is intended to provide approximate times for the Smith Care Center, Seaside Assisted Living, Star Residences, Memory Care, East Garden, West Garden, and Northwest Garden, and a few tower residents who received their initial vaccine on December 30th. Again, I'm going to repeat that. Smith Care Center, Seaside Assisted Living, Star Memory Care Residences, East Garden, West Garden, Northwest Garden, and a few tower residents who did receive that initial vaccine on December 30th. Now, those few residents from the aforementioned colonies who received their initial vaccine on January 4th, they'll receive their booster on the 25th. Now, as we did in the past, and it went very, very well, thanks to all of your cooperation, you'll be advised when I announce your colony to proceed to the Mayflower Restaurant to receive that booster. Now, from a team member vaccine perspective, team members, such as ourselves, who received their initial vaccine on December 30th, along with any team member who wishes to receive that initial vaccine, will also be administered the vaccine during the afternoon of this Wednesday, January 20th. Let me say that again. So team members who receive their initial vaccine on the 30th, along with those that would like to have the initial vaccine, that'll also be administered during the afternoon. And I'll announce that time this Wednesday, January 20th. Karen, as you know, and I'd love for you to comment on it, we've commenced our team member education series focused on addressing the fears related to the vaccine. We call it Voices for the Vaccine, and is in the play Hamilton, urging people, don't throw away your shot. I have received some very, very fine comments on team members and others who've seen those videos. They're very well done. And in fact, in one video, I know you're mentioned, which is a very nice comment from one of the team members. Compelling.
Absolutely, Harry. You know, our team members talked from the heart. They shared their experiences with what it was like to really have COVID, or someone that they loved had COVID, or in some cases, a whole family had COVID. And it was very heartwarming to know that, we played a part, and each one of those team members are going to get the vaccine because they know how bad COVID is. So it's been quite an experience. Quite an experience.
It really is. And I stated last week that we've got roughly 42% of our team members who have taken the vaccine. And we're optimistic that that number is going to go up. We'll know more, of course, this Wednesday. But I saw the updated numbers nationally, and among healthcare workers, it's a disappointing 32%. 32%. So while we're 10% above that average, that's not nearly enough to really maximize the impact of this vaccine.
We are going for the stars. We want Plymouth Harbor to be one of the safest places to be. And that's with our team members and our residents vaccinated, ready to fight that virus.
That's right. And I know we're all excited around here. We've had several meetings. I had one this morning. We're going to do a walkthrough tomorrow morning as we tee up with our partners from CVS as we administer the vaccine this Wednesday, January 20th. So to all of our residents and team members, be listening Wednesday morning around 9 a.m. for my first announcement. And then keep in mind, disembarking a cruise ship, I will then be announcing colony by colony when we'll be ready for you to proceed to the Mayflower restaurant. You'll get checked in, you'll go through the vaccine clinic, and then you'll go into a monitoring area, which will be near the cafe for about 15 minutes where we have nursing personnel on standby. And then you'll be released to go back either to your apartment or back to your workstation. So
we have a little bit of a different look too to the flow of things. I think it's going to be much smoother and a little bit more elbow room, so we don't have our own little issue there at the Mayflower. So know that it's going to be a little bit different, but the quality is still there and those vaccines are waiting for us.
And Karen, I've been asked by some residents, will they have an opportunity to see the team member videos on the Voices for Vaccine? The answer to that is yes. And we're going to start releasing those, I think later today, I've been told, no later than tomorrow morning. And each one is somewhere in the vicinity of 3.5 to 5 minutes. They're very well done. Also in the later editions include 3 of our physicians, residents. And then I had the opportunity to sit down with Dr. Bruce Berg, who is the chairman of our board of trustees, for a very nice conversation this morning. And we'll also be posting that as well. It's all about education.
Absolutely. You know, we've had a few questions too about cards. Will our staff and residents be receiving cards from CVS stating that they have had that vaccine? Yes. As soon as you are done with that second booster shot, you'll get your card. And again, I think Harry has alluded to this as a passport. You can proudly declare and show your card that you have been vaccinated.
You know, I can remember the young man, he's an RN, at one of our meetings last week. And as I was talking about different aspects of this, when I said, you know, I'm convinced that at some point in time, it could be toward the end of this year, I think these vaccination cards are going to be like a passport to get in the restaurants, to get into concerts and different venues. So I think it's, if nothing else, it's really going to allow you to spread out more after we've all been so isolated almost a year now. So
yep. It's going to be time for hugs.
That's
We're all
right.
ready for that.
That's right. Well, Karen, that's all I've got on my agenda today. Unless you have something else, I'll let you take us to the closure of this video.
Okay, we want to remind you to keep that social distance, that 6-foot perimeter around you at all times. Remember to hit those high contact areas with that antibacterial wipe and wash your hands quite frequently during the day. But more importantly, when wearing a mask is a simple tool that will really help save a life. It'll save yours, it'll save mine and Harry's. Let's all remember, don't forget, let's don our mask.
Okay, Karen, that brings the conclusion to this video. So it is time to don our masks.